Health is about much more than just not being sick. It's also about feeling good about yourself, having a supportive social network, and being able to live the life on your own terms. We need to pay much more attention to these factors to improve the health conditions for many more people and to make these conditions more fair. My name is Lenneke Vaandrager. I'm an associate professor in the Health and Society group. A red thread through my whole career has been my fight for social and environmental justice. Also as a student when I did my internship in Liverpool in the UK. With my research I showed that you cannot require families living in poverty to eat healthy, if the only thing you can buy in the neighborhood are processed foods and soft drinks. I would work on a more fair and just world. That's a central theme in my work. I'm researching the inclusive healthy setting because I see circumstances where not everyone has the same opportunities and choices. Not everyone can have an active lifestyle because the lack of safe walking paths or cycling trails. Not everyone lives in an area where there's enough green, where you can recreate and relax. I study this on various levels and also try to understand how we can make some everyday life circumstances better. To give an example, for people living in a vulnerable position, the living environment and housing plays an important role. In a living lab in Nijmegen, we work with an inclusive health promotion approach. Together with a network of a Green Citizen Initiative, the Broederij, housing cooperations, community work and volunteers, we focus on how to improve living conditions rather than a focus on individual problems such as loneliness of citizens. And we do that by community greening and cleaning up gardens. In turn, these citizens help others by cooking nice food in the community center. People feel they can play a meaningful role in society. Their gardens look really nice and social cohesion improves. We also look at how local governments can support these bottom-up initiatives and how the health, social and physical domains can collaborate much better than they do. How healthy people are is influenced by so much more than their individual healthy or unhealthy lifestyles. Our government invests a lot in cure and a little bit in prevention of diseases. I think it's really time to invest in society and health promotion, in societal and physical conditions that make all people thrive and live happy and meaningful lives. And in the end, that will save a lot of money in the healthcare sector.